name is Connor Housen, so I'll be completing Practical Assessment 37, Oral Anatomy and Charting. So today we have Henry Mannett here. He's an 11-year-old 5-month beagle. He does have a 3.5 heart murmur, and he's in today for a dental scale and polish with some extractions. So, before we begin, we have washed our hands with warm soapy water for under 20 seconds and applied minimal PPE, including disposable gloves and a mask. We should be wearing safety goggles at the moment for our dental procedures. However, our clinic doesn't have any, and I will just be continuing without them. We want to begin with a comprehensive oral exam to evaluate the intra and extraoral structures of the face, including the supporting structures of the face and the intraoral structures as well. We want to be taking note of the head shape, and we want to be looking at the hard and soft palate of the mouth. Our clinic uses the Trinidad encoding system. So that is a 3-digit encoding system where the first digit denotes the quadrant and the second and third digits denote the specific tooth. To the left maxilla, we're beginning with the first quadrant. To the right maxilla is the second. Down to the left mandible is the third. And then down to the right mandible is fourth. So we're just going to pre-fill in Henry Mannett's dental chart here, and we want to be taking note of every single tooth from the first quadrant from the right maxillary to the left maxillary, down to the third quadrant, which is the left mandible, down to the right mandible, which is the fourth quadrant. So on the dental chart here, we want to be noting any missing teeth, and that will be abbreviated as a circle. If we have any fractures, it'll be noted as a hashtag. If we have any planned extractions, it'll be noted as a slash, and then once that has been extracted, it'll then be crossed out on the dental chart. If we have any mobility issues with individual teeth, it'll be noted M1 to 3 based on the tooth mobility. If we had any gingival recession, it'll be noted as GR. Any caries will be noted as CA. If we had any shading, say on the buccal side of the teeth, for instance, then we would gently shade the back of the tooth here on the dental chart just to show where it will be stained. And if we had any periodontal pocketing above 2 millimeters, that would be needed to be noted and will be written as the number millimeters next to the indicated tooth. So every dental procedure must begin with a comprehensive extra and intraoral exam of the face, the surrounding structures, and the internal structures of the mouth. This includes the hard and soft palate of the mouth, noting the head shape as well, if they are brachycephalic or mesocephalic. This also needs to be noted. We also need to take note of any abnormalities or any fractured teeth that have been noted. So, based on Henry's mouth that I have observed, I have noted that he has a gingivitis score of 2 based on the slight bleeding which has been seen and the light redness and inflammation seen in the gingivitis. Gingivital sulcus. Then I've given it a calculus score of 3 based on the PRAC rating, which I have noted. We would note the grading to be above 50% if it would be indicated to be a 2, or above 75% if it would be indicated to be a 3, or 100% calculus will be noted as a grade 4. His current home care dental diet consists of a dental treat given weekly, and he has difficulty doing daily teeth brushing, so he's refrained from that. Instead, he's giving a dental water additive in his water nightly to improve his periodontal health. We have recommended 6-month dental checks, as he has only currently been coming in for the yearly dental checks and a bi-yearly dental scale and polish procedure. We will begin by probing every single tooth around the particular area. So you want to hold it in a modified pen grip. You want to be very careful when holding it. So I'll just note here, we'll be going from the 403 incisor. So we want to be probing around the entire circumference of the tooth. We want to be taking note of the motility. We want to be taking it of the gingival sulcus, the pocket depth. If we've got a pocket depth of anything between above 2 mils, it does require investigation, and we'll note that on the dental chart. here, I can see quite a pocket depth of about 3 mils there, so I will just note that on the dental chart, and it's got a calculus grading of about 2 there. When you are grading the teeth, the vet will generally call out 2 numbers, the first being the calculus score and the second being the gingivitis score. So here we have the 401 canine. As I move back here, we have the 407 molar, and then we have the 408 premolar here at the back. We want to be looking for any obvious abnormalities or any fractures, be taking note of any furrification lesions or any caries that we can see, noting the pocketing depth, and we want to be going around the entire circumference of that tooth. Now, I'll note all of what I can see here on the dental chart. I can see I will give them a grading score of 3 for the calculus, and for the gingivitis, about a score of 2. You're looking for the redness, any inflammation, any erythema or any swelling around the gingival sulcus as well, or any intense bleeding that may be noted, and that would be noted on the dental chart. And I'll go through the post-op treatment dentition here, based on the dental chart, which I have completed as such. So he came in for some extraction today, and based on the pre-op exam, I noticed that 2 missing teeth. We had the first premolar 105 and the second premolar 205. We had a couple of mobile teeth as well to take note of. Only mobility of 1, but it is just to be noted, and I will advise the veterinarian and note that on his hospital chart and add that to his patient file on EasyVet as well. So that was the 304, 301, 304, and the 405 premolar, which had a mobility of 1. We had no gingival recession, nor did we have any tooth resorbative lesions or any fractures, which I have noted. We did extract today the 401 incisor and the 404 canine, so I have noted them there with a cross to indicate that they have been extracted. I will advise the owner for some home care dental recommendations to maybe move to more a dental specific diet, such as TD Hill's diet, as he is currently on the Pernia Supercoat, and that may not be the best dental friendliest diet for Henry. I would recommend maybe upping the dental treats to maybe 2 a week instead of just the 1 if he still is having difficulty daily brushing, but I have reiterated the importance of daily brushing, and that we highly recommend it in clinic to use a finger brush and use the circular motion in the evenings preferably, to maintain that dental health. I have also noted there have been a couple of periodontal pocketing as well at the 104 canine and then the 207 premolar of a 3mm depth, which must be monitored. And I have advised this to the veterinarian to take note of this, to keep monitoring that next time he comes in. Henry is on yearly dental checks as well, but I have recommended a 6-monthly dental check just to keep on top of that calculus and plaque as well, as it was quite a high score of a grading of 3. I have also recommended to monitor the gingival sulcus for any redness, swelling, or inflammation, as the gingival sulcus was bleeding quite a bit during the dental. I have also noted some light staining on the 104 canine, and then also on the 304 canine as well. There was some moderate staining on the buccal side of the tooth. So I would also note any specific teeth to watch as well. I would advise the veterinarian, and I'd also advise the client as well to keep monitoring that at home. If he has any problems or concerns, to give the clinic a call promptly, and we can suggest where to go with that. And any information that the owner must be aware of at the time of discharge would include the extractions that we have today, the mobile teeth to keep monitoring of, and the periodontal pocketing. But other than that, that is everything today. That is ACVN, Practical Assessment 37, Oral Anatomy, and Charting.